Hi everyone, thank you for tuning in to First Aid Friday. I am Bree Maloney. I'm here with Dr. Nathan Kiskila. How are you doing this Friday?
I'm excited to be here, Bree. Thanks for having me.
Great. Well, he's in between patients right now and he wanted to do this First Aid Friday with us. So thank you so much for tuning in. And so we'll just kind of jump right into it. So today's topic, it was specifically picked because we've been seeing pretty much everything. I mean, we've been seeing flu, we've been seeing bronchitis, but a lot of cases have been sinusitis.
It's that time of year.
It's that time of year. God bless it. So we're going to talk to Dr. Kiskila about sinusitis, aka sinus infections, what some of the signs are, symptoms, causes, different types, which I found out about today, and the different treatment options. There we go. So we'll just dive right into it. So, Dr. Kiskila, what is sinusitis?
Well, remember, Bree, that when we talked last Friday about bronchitis, I reminded everybody that itis in doctor terms or medical terms means inflammation. So sinusitis is just a fancy medical way of saying sinus inflammation. Okay,
so sinus infection. Now you can all tell your friends and family that you know what itis means, and you can just say, I've got sinusitis.
Yep, sinusitis, tonsillitis, bronchitis. So today we're talking about sinusitis.
Okay, so sinusitis. So it's an inflammation of the inner linings of the nose.
Your sinuses, we have sinuses here and here, and so those sinuses get inflamed. Basically, the inner lining of your sinuses thicken, and we can talk about for what reasons, and when they do and they get inflamed, that causes a sinus infection or sinusitis.
Okay, gotcha. So I just learned that there's different types of sinusitis. So can you go over for us what the different types are?
Yeah, like I said, anything could cause a sinus inflammation. Typically, it's infection, or if it's a sinus infection. Those infections, like all infections that we typically talk about, could be viral or they could be bacterial. So we have viral sinusitis, we have bacterial sinusitis. They could be short-term, so acute, or they could be long-term, what we call chronic. I think 12 weeks is our cutoff. If it's lasting more than 12 weeks, we call that
12 weeks?
A chronic sinus infection. And so what happens is our sinus cavities fill up with that infection. Because of gravity, they typically fill up here faster, or more commonly here in our what we call our maxillary sinuses.
Okay.
And when that drains, maybe we don't feel so bad, but then it kind of builds up again, and then it drains, and then it builds up again. And so sometimes we can kind of wax and wane, and so it's pretty easy for sinus infections for maybe people to go a week or 2 or 3 or 4, or even months sometimes without really seeking treatment, because maybe it doesn't bother them, or it only bothers them for a short term, and then it kind of drains, and then it feels a little bit better.
Gotcha. So the different types is the acute, what you were just talking about, which can last probably 2 to 4 weeks or something, depending.
Well, typically, if a sinus infection is about a week to 10 days, we would consider that what we're going to talk about today, and that's First Aid Friday. We would consider that just a viral sinusitis, something you probably don't need to see a doctor for, something you can just treat at home. If it's lasting more than 10 days, then that's still an acute sinusitis, but that's one that doctors may think may be a little bit more bacterial, or something that may need an antibiotic treatment for.
Okay, interesting. Thank you for that. Okay, so we just defined what some of the types of sinusitis are. Now, I wanted to ask you, so who's more likely, is there certain, is it more people likely to get sinusitis other than others, or describe that for us?
Sure. So like I said, sinusitis is an inflammation of your sinus cavity.
Okay.
The most common culprit is allergies. So uncontrolled allergies are what cause irritation. But here in Southern California, we get what we call the Santa Ana winds, where the winds change and they come in from the east. That really irritates a lot of people's sinuses. So
that can kind of trigger a sinusitis infection.
Exactly, and so we have a famous airport here, John Wayne Airport, and the planes land from east to west, but when we get those winds coming this, what we call the Santa Anas, the planes turn around, they land from west to east, and whenever I leave my house and I see that on my way into work, I think, oh, I'm going to start seeing a lot of sinus infections this week because those winds are coming in. So anything that could irritate it, obviously uncontrolled seasonal allergies, but it could be dust, it could be a head cold that can cause irritation. In fact, a lot of times just a runny nose, or what doctors call a rhinosinusitis, meaning your nose and sinuses get inflamed from a common cold. So common colds or upper respiratory infections that we see this time of year can kind of be culprits to cause inflammation of your sinuses and cause sinus infections. So sinus infections could be a secondary infection. We've talked about that before, from just a normal head cold. And so those are the most common reasons that we see sinus infections.
Okay, great. And if you're just tuning in now, I am Bree Maloney. I'm here with Dr. Nathan Kiskila. We are going over sinusitis or sinus infections, but if you really want to impress your friends, you can say sinusitis, because itis in medical terminology means inflammation. So sinus inflammation, sinusitis. So we just went over the different types, and now I want to get into some symptoms, because like a lot of people that are tuning in, I have had a sinus infection, and the symptoms can be mild, but some of them can be extremely severe. So what are the most common symptoms, Dr. Kiskila, of sinusitis?
Yeah, so like I said, our sinuses are here and here, so it's usually pressure, sinus pressure. Typically because of gravity, it's here. Now, once your sinus cavities fill up, they could put pressure on your ears, so you can have ear pain or pressure. They actually could put pressure on your gums or your upper teeth, so you can have teeth pain. In fact, I've had a lot of patients go to the dentist thinking they have a tooth infection, and then the dentist does a x-ray and say, no, actually you don't, but you're on the same x-ray, I can see your sinus cavities are full of infections, so you got a sinus infection.
So interesting. Okay.
So a lot of times we see tooth, gum, mouth pain, ear pain or pressure, obviously sinus pain or pressure. Some symptoms that are kind of uncommon, but we can see, and those are the ones that maybe we want to see a little bit sooner, or a medical, more likely to be evaluated by a doctor sooner than later, would be any kind of eye pressure, especially if it's causing eye pain.
Like if you move your eyes and you have that kind of strain.
Kind of pain, or vision changes. If you had a lot of swelling around your eyes, so we see infection that's putting pressure on your eyes. Our eyes are important, so we want to, but that could happen. Obviously, sinus headaches, so you can have a really bad sinus headache. That's another common symptom. And then fever. Fever means infection, so you can have a fever. And but honestly, sinus infections typically don't have a fever, but again, and then because of infection, just any symptom of being of infection, not just fever, but it could be body aches, chills, fatigue. I'm just sick. I don't feel good feeling. Obviously, blowing your nose, getting that snot out, whether it's clear, green, yellow, brown, all, whether it's more liquidy or mucousy, all that could be just a sinus drainage. So those are the typical symptoms.
Okay, great.
We'll see.
Thank you so much for that. Now, so let's say I come in and I have some sinus pain and pressure. How can you determine if a sinusitis is viral or bacterial?
So the only way to 100% know is to get some sample. So for like an ear, nose, and throat doctor to stick a camera up into your sinuses and get a sample, send it to the lab. Takes 3 to 5 days to grow it out on a culture, and then that culture says, oh, this is bacterial or this is viral. Now, a lot of people don't do that unless it's chronic and they've maybe treated it 2 or 3 rounds.
Multiple infections or
exactly. And so doctors usually kind of use that 10-day rule, about a week to 10 days. If it's under 10 days, likely viral, probably just gonna do what we call supportive therapy, kind of leave it alone. If it's over 10 days, then we're probably more likely gonna think that it's bacterial, maybe needs an antibiotic to get better.
Okay, gotcha. Now, we did have someone, because I did put it on Instagram, where people can message us if they had some questions regarding sinusitis, if they wanted us to answer. So one of the questions that someone asked us is, if they blow their nose and it's green mucus, is that automatically like a sinus infection, or is that automatic like a bacterial infection?
So it's not automatically a bacterial infection. So just because it's a certain color, like green, doesn't mean it's a bacterial infection. So it does not mean automatically. However, especially if it's lasting over 10 days and it's turning colors, like from a clear color to a green color, a lot of doctors will kind of consider that as more likely, maybe bacterial, more likely want to treat it. And so it's not a guarantee, but it is kind of one of those things that maybe lead us more towards the side of maybe we should treat this.
Okay, gotcha. Well, thank you so much for that. So that was one of the questions. And so let's go over some of, and if you're just tuning in now, my name is Bree Maloney. I'm here with Dr. Nathan Kiskila. We are going over sinusitis, aka sinus infections. We went over the different types. We went over the different symptoms, and we went over bacterial and viral. But now let's go over some treatment options. So let's say that we come in and you definitely have a sinus infection. What would you tell your patients?
Well, typically I tell my patients to do the home remedies first. And so
Okay.
being First Aid Friday, what can you do,
Yeah.
at home without coming in to see a doctor? Well, one thing is all that infection, we want to get it out, right? And so just even blowing your nose or helping anything to open this up to kind of get that out. So like warm steam is sometimes helpful, or like a warm washcloth, or
Like compresses or something? Okay.
Standing in a hot steamy shower could be helpful. And over-the-counter Mucinex. Mucinex is supposed to break everything up to help it drain, so an over-the-counter Mucinex may be helpful. There's a nasal spray, over-the-counter steroid nasal spray called Flonase is a brand name. So a Flonase nasal spray can help open this up to kind of help it drain. And so I usually recommend a over-the-counter Flonase, an over-the-counter Mucinex, and then they have some different nasal saline rinses. Neti-Pot is a brand name where you kind of squirt water up there to kind of get up there and help everything drain out. They're not very pleasant to use, but they are helpful in getting all that out. And so those three things, typically a Mucinex, a Flonase, and a nasal saline rinse along with the hot steams is helpful to do at home. A decongestant like an over-the-counter Sudafed initially could be helpful to help with some of the symptoms, the decongestion,
The pain and
in
stuff.
the short term. In the long run, they actually are kind of have a counter kind of effect to that, to where they're not so helpful and can make things worse. And so just for the first few days, sometimes a Sudafed decongestion could be helpful. In fact, they make Mucinex with Sudafed. They call it Mucinex D, or decongestion.
Oh yeah, that's right.
Nasal Afrin is not really recommended. It's something I usually don't recommend. That's an over-the-counter nasal spray that kind of just gives you a false sense that everything's cleared up there, but then as soon as the medicine wears off, all the symptoms come right back, and they usually come back worse. So we have kind of what we call this rebound sinus pressure that's worse than what you started. So I usually stay away from that. But as far as First Aid Friday, big things you can do: home, steam, Mucinex, Flonase, nasal saline rinses.
Warm compresses.
Warm compresses.
Yeah, I mean, speaking of warm compresses and everything, so I actually used to have a really bad, and this was kind of one of the things that can kind of trigger sinus infections too. I had an extremely bad deviated septum. I played volleyball in college. I got hit in the nose. My whole nose went sideways, and I went to an ENT, actually a surgeon, and he said that over 90% of one of my nostrils was blocked. And so I feel like I remember I kept getting sinus infection after sinus infection, and I think that was one of the reasons, because I couldn't breathe out of both nostrils, but I had one sinus infection and I looked like I had my wisdom teeth out. Like my whole face swelled up, even my eye, and but it was only one side. And I remember going over to my parents' house. My parents were like, okay, what is going on? Yeah. So I ended up having surgery and kind of fixed everything. But yeah, so what really helped for me though was the steam, what Dr. Kiskila was saying, and the warm compresses, anything if something's inflamed, let's say you have an inflamed muscle, heat is the best way to kind of relax it, kind of open up everything. And so that's what I would recommend. Yeah,
that's a good point. I'm glad you brought up the deviated septum. So some people are more kind of what we call prone to sinus infections. So remember I said uncontrolled seasonal allergies is a culprit. So if you're more sensitive to certain seasonal allergies, then you're more likely to get sinus infections. If you have a deviated septum, remember I said we want all this to drain. So if it can't drain, then it's more likely to get up there and stick up there and turn into an infection. And so deviated septums are often a culprit. Even anatomy, everyone's face is a little bit different. Sinuses are a little bit different. As we age, our sinuses change, and so sometimes when we're younger, our sinuses don't drain as efficiently as we want them to. But then, once we hit maturity, then they change a little bit, and so sometimes just anatomy can
so some people are just born with being more susceptible
for those reasons. But yeah, good point. Deviated septum can be a culprit to where it's harder for everything to drain.
Interesting. Well, I think that was really all of the questions that I kind of had for Dr. Kiskila. We had some people, again, message and DM us with some questions that they wanted answered. And that's what I encourage. If you guys, even if anyone has any topics that you would like for us to go over, I mean, we're going to still keep kind of going, informing people what's kind of breaking out right now, seasonality. But if you guys have any topics that you would want us to go over, and if you see a topic, if you have questions, we will answer them on this video live. So so thank you so much. Thank you, Dr. Kiskila, for informing us more about sinusitis, about sinus infections, about the different types and symptoms and treatment options on this First Aid Friday. So anything else to add?
You just made me think of something I forgot to mention, but in your case where it was more one-sided or unilateral, so when it does present more one-sided or unilateral, now it can spread to the other side, then that's more likely for a doctor to think infectious, bacterial infection.
Oh, okay.
Whereas like allergies and viruses are usually both sides, and so when it presents more unilateral, that's kind of more of a reason for us to think maybe we want to treat this with an antibiotic medicine. So thanks for mentioning that, and kind of reminding me one of those last points. But happy to be here. Let us know what you guys want to hear, and I know Bree's got some legal closing remarks that we always want to share with everybody.
Yes. So I usually read them, but I don't have them today. So just off the top of my head, this information that we are providing you is for educational and informational purposes only. We are not liable for anything that is misconstrued on this video. So if you have any conditions, always feel free to bring them up to your primary care physician or one of our doctors here in our urgent care. But thank you again for joining us on this First Aid Friday, and we will see you next Wednesday. I'm going to be interviewing Dr. Kenny. She is our new Children's Hospital of Orange County CHOC pediatrician. We are going to go over RSV. What does RSV stand for? Respiratory
syncytial virus. So
okay.
Yep.
Yes. So tune in on Wednesday, and we hope you all have a great weekend.
Happy weekend.
Take care.